Hi, this is Gary from BODYTEC, the original EMS training, and for today's clip I would like to talk to you about back issues. Meaning, back issues are a very broad aspect of today's society and occur very often, also across different age groups. In earlier days it was very often a thing for elderly people, but today even younger people in their late or early 20s might actually suffer from some difficulties with the back or a disbalance between their front side and their back side. The nature of back issues is very variable. We can have possibilities for bone structures, for injuries, for muscular insufficiencies. But very often our daily living habits and our working habits do not really contribute towards our physical nature. Meaning, in this day and age, in our working and leisure environment, very often we are seated for a very long period of time. But our bodies are performed for actual motion. And regarding this, there's an insufficiency of activity of our muscles around our torso, and especially between the interplay. Very seldomly we have very deep interaction and contraction with our core muscles and the deeper muscles of our abdomen. The benefits of training itself obviously help with the interplay, but also with the strengthening of this muscle corset. Looking at training with BODYTEC, the original EMS training, what we see is a very intense and highly intense activation through the actual training device together with a dynamic motion. Meaning we've got muscle activation at the same time on the front side as well as at the back side. And on top of this, we do not only reach the superficial and stronger muscle layers, no, the impulses through the EMS device also stimulate deeper muscle layers, contributing towards a very good interplay, but also through a very strong activation of parts that we actually struggle to train when we go to a gym or if we do some exercises at home. If we look at the contribution of BODYTEC EMS training towards the strengthening of the lower back muscles, or not just of the lower back, but also of the whole core area in interplay, we have two aspects that are very important here. With BODYTEC, the original EMS training, we're doing dynamic motions. As you can see here right now, there's a dynamic motion that initiates a contraction in the specific core area. And on top of this, the machine sends a very deep, intense impulse that is completely irrelevant of physical performance and stimulates the muscles in the lower back, in the abdominal area, and even in deeper muscle layers in between. Meaning that the interplay between back and front side of our torso is highly interactive, which is quite difficult and very unusual for our normal training. If we train in the gym circumstances, then very often we have a passive activation, whilst here we have the activation of the machine plus dynamic motion. And it's completely stress-free for joints, for spine elements, and the main tissue being activated here is our muscle tissue. So now with the actual EMS training device, this increased activation strengthens our muscles itself, which is highly contributive towards perceived less back pain. There's been a research project in Germany being done with people who suffer from back pain for many years. The findings of this research was that a couple of weeks EMS training, regular EMS training with the MIHA BODYTEC device, actually showed an increase in muscular strength in the core area, front and back side, as well as a reduced perceived pain. Some people were even cleared completely, even though they suffered from back issues for many decades. So there's research backup for the actual method of training with BODYTEC, the original EMS training, and as well the perceived well-being that happens through the activation with front and back side at the same time, and in a very constant interplay helps us to coordinate the movement that helps us having an upright posture and a better perception of our actual physical existence. Okay, stay tuned for more tips and clips for the next issues.